So I welcome all the participants and special welcome and thanks to respected Markandeya Sir.
Namaskar. Good evening. I'm really happy to be with you through the platform of our Maharashtra State Gazetted Veterinary Officers Union. Today we have with us Dr. Gade Sahib, Dr. Zamre Sahib. There are many seniors, many colleagues and many friends. Last week we have discussed about the basics of animal reproduction. The particular topic will be made available definitely on YouTube for you all, and the link will be shared to you by the association. Today also we are going to discuss about the infertility problem, and instead of making the topic broad, we have cut short this particular topic into two parts. Number one is non-infectious repeat breeding, and next time on next Monday, if it is convenient, we will be once again discussing about the infectious type of repeat breeding. So these are the two things which are to be discussed under animal infertility. Infertility, that is reduced degrees of fertility. Animal fails to conceive. Animal takes a lot of time to conceive. And this is only because of many factors, many causes. Friends, this infertility is very difficult to tackle under field conditions because majority of the cases, as per record, are of nutritional infertility. To convert this nutritional infertility into a fertile type of aspect and to make the animal fertile is very, very important one. Again, hello, Pandey sir, please switch off.
सर्वांना विनंती आहे की खूप सुंदर सेशन आहे, त्यामुळे आपले आपले माइक म्यूट ठेवा.
The first slide will indicate an animal which is crying for want of maybe nutrition, for want of management, treatment by the owner. Cruelty starts if the animal is infertile. Cruelty starts if an animal is unproductive. And we have to deal with all type of infertility problems, of which today we have to discuss, or we are going to discuss, regarding the non-infectious repeat breeding problem in case of animals, and particularly dairy animals. We will also discuss about the farm animals. There are two important things with the first slide, that my email number is Swaniti, N-I-T-E-E, please, at both the Reddit mail and also for Gmail, it is Swaniti. That is one E is missing. That is I would like to make it clear. Next slide. Let us go to the next slide. Now, friends, this is a complaint. This is a complaint that I am having a repeat breeding problem and I am suffering from a long. Animals do cry because of this type of problem, and owners, they are really frustrated in dairy business because of this repeat breeding problem. 4 times, 5 times, 6 times, animal continues the cyclicity, animal fails to conceive, and reasons are not identified. Proper treatment is not possible because of the diagnosis, and the animal leads to infertile stage. The nutrition of that particular animal becomes reduced, and thereafter this weak and emaciated animal is out of breeding. This should not happen. When animal is cyclic one, when animal is in the reproductive phase of pregnancy, postpartum period, and then cyclicity, immediately animal should conceive. That is our goal. And a calf per year expects that a cow should become pregnant on 81st day of calving, and buffalo is expected to become pregnant on 111th day of calving. So 3 months for cows and 4 months for buffaloes. That is our assumption. This is worldwide acceptance. When we are trained technicians, when we are trained officers, no infertility case, and particularly that of the non-infectious repeat breeder problem, should remain unconceived, if our approach is proper one. Slow and steady wins the race. Never with the first and the foremost and with the first treatment, animal will conceive. It is not like that. We will have to study that particular case in detail. And once we are in touch with that particular case, definitely animal will conceive. Friends, because I am involved with gynecology since last 35 years, it's my really frank experience that I just consult telephonically. Whatever the treatments are there, you are opting those type of treatments, you are adopting those treatments. And if not 100, at least 70-75% their animals are getting conceived. Maybe it is an infectious one, or maybe it is a non-infectious type of the case. But confidence is most important. And if we are analyzing the case in a proper manner, definitely we are able to achieve the success and we are able to make the animal pregnant. Next one. Next. Right. In any case, we will have to abide with this particular chart. Since all PPTs will be circulated to you, please remember this type of chart, because whatever hormonal treatment we are going to give to the animal, this will be in the line of these type of graphs. Whenever there is availability of the progesterone in the cyclicity of the animal, that time only we are going to give the progesterone. Whenever LH is maximum, that time we are going to give GnRH and LH. And when we are expecting more progesterone, we are prompting this particular progesterone with the GnRH at appropriate stages. So this particular chart is very important. And I have already told regarding this hormonal basis. Proestrus, maximum FSH. Estrus, maximum estrogens. Metaestrus, maximum LH. And the last one, diestrus, maximum progesterone. So this is our schedule as per the hormonal profile is considered. And in case of non-infectious repeat animal, many a times we have to depend upon the hormonal type of treatment. And therefore, I have repeated this, that maximum FSH in proestrus, maximum estrogens in case of estrual stage, maximum LH in metaestrus stage, and maximum progesterone in case of diestrus stage, of which estrogens and FSH are of no use when animal is cyclic. So we should not bother for the first two hormones, maximum FSH and maximum estrogen. Whatever is the challenge, that is to be accepted with that of the LH and that with the progesterone, that we will discuss. Next one. Next. That's right. Definition. What is repeat breeding? Animal repeats. Consistently, animal repeats and animal fails to become pregnant. Animal repeats after exhibition of normal or nearly normal. So when we use this word normal, it is apparent. It appears that everything is normal. And therefore it is, we say that it is a normal one. Nearly normal, approaching toward the normalcy, such a type of distress, even if animal is covered by a fertile bull, again the same thing, fertile or nearly fertile bull, animal fails to conceive. First attempt, second attempt, and after third attempt, the case is clear-cut infertility case, and we categorize it as a repeat breeder. That type of animal is a repeat breeder type of the animal. And this particular repeating is for n number of times. Many a times farmer breeder, they say that since last 8 months animal is repeating. Since last 6 months animal is repeating. Too much. But if owner is involved in making the animal pregnant, definitely our job is very much simple and that way easy. This is a burning problem as per the dairy animals are concerned. Maximum number of dairy farms which have been closed in the past, it is only because of the repeat breeding problem. Animals, they repeat, and owner is failing for technical information on this particular aspect. He is not interested to involve in the animal reproduction, basic of animal reproduction. And therefore, this is a major problem for the dairy owners. Maximum information should have been about animal reproduction to the dairy farmers. If they are trained with animal reproduction, nutrition and management, those things can be covered by the guidance. But for reproduction, their involvement is necessary. Second important thing is that if we consider the total infertility problems, unstressed cases are that way simple to treat. If a case is unstressed one, we are increasing the body weight, we are feeding that particular animal with the nutritious diet, we are covering total nutritive care, and that animal automatically comes into the stress. We have sure shot methods to make the animal pregnant. All hormonal protocols, there are 100 different protocols available, and we can use those protocols in case of good body conditions for having type of animals, and definitely we can make these animals pregnant. We can make them into cyclists. But the repeat breeder animals, it becomes very difficult that even after having everything normal and normal health, normal nutrition, when animal is coming into these stress, it indicates that yes, nutrition is nearly normal, still animal repeats. These animals are cyclic non-breeders. Cyclicity is a continuous one, but animal is failing to conceive, and therefore another name is cyclic non-breeder animal. Incidence is the same in case of cows and buffaloes, but this incidence is more in case of multiparous animals. Heifers are that way less affected as far as this problem is concerned. Still, there are cases in case of heifers also, but maximum multiparous animals, they suffer this type of problem. Another important thing is that this particular problem is least cared for diagnosis. And we have seen in democratic India that people, they cry for milk rates. They are asking for higher milk rates, but not a single animal owner, dairy farmer is asking for establishment of animal diagnostic laboratories, facilities for culture and sensitivity test, facilities for blood sampling. So these are the basic things for the dairy farming. And if we are pinpointing the cause, it is possible for us to treat that animal. Every time we are considering, we are using our knowledge and we are making the animal pregnant. But had there been a demand for diagnostic laboratory for animals, and if this particular laboratory works round the clock with experts in the laboratory, many repeat breeder animals, they will get chance to become pregnant. Last one, very pathetic situation, that if buffalo is repeating more than 5 or 6 times, that particular buffalo has the last destination as a slaughterhouse, and we are losing our economy in this. And therefore, please remember that in no case we are going to have this type of problem in case of the animals. So I was discussing about this type of a problem, and also I'm going to discuss about a basic concepts in this repeat breeding problem, how veterinarians and how animal owners, they are involved in this particular infertility problem. Any type of problem is to be dealt with the mutual understanding of owner and veterinarian. A trained veterinarian can quickly diagnose the condition. If owner is able to answer his queries, if the reproductive history presented by the owner is perfect one. So if such a type of things are presented by the owner about the reproductive history of the animal, it is possible for a veterinarian to come to diagnostic conclusion. And if the diagnosis is perfect, treatment is a simple type of things. Doctor is recognized only because of his diagnostic skills. Treatment, every type of treatment is possible for others also. But diagnosis is only possible for the trained, experienced, and the skilled type of veterinarians. I'm sure that under field conditions, you must have handled many type of cases this repeat better type of the cases. You must have your own experience in this type of handling of the cases, but we should have a common approach. And if we go with this particular approach, definitely we will be able to handle the cases of non-infectious type of repeat breeding. So today I am not going to discuss about any type of infection. Subclinical endometritis we are not going to discuss. Antibiotics we are not going to discuss. We are also not going to discuss about the type of the infectious discharge which is wired out by the animals, but non-infectious, when estrus is normal and clear, having best type of the signs, what type of approach we should have. Yeah, slides will start with, yes, next one. First class. This is economically related. This problem is economically related, and this is a presentation is by one of the pharmaceutical companies. Say annual national loss is 35,000 crores. 35,000 crores, and this is only because animals are repeating one. Per day expenditure, per month expenditure. If the animal is milking one, if animal is empty one. So this type of slide will indicate that what losses we are increasing with this type of repeat better type of the animal. 6,000 per cycle. This is too much, and therefore we have to deal with this infectious with this infertility problem in a proper manner. Next one. Right. Now these are many points. Many friends may not agree with me, but please remember that animal owner should have history about the reproductive activities of the animal. Written history is not available generally with that of the animal owner, and therefore there is a cyclicity, continuation of the cyclicity. Number two, animal owner fails to have his detailed observations. Animal is repeating, it's okay, but about that cycle, he should have his own observations about the estrus, estrual signs, estrual behavior, estrual duration, and so on. That particular point, these points are missing with the animal owner. Third important thing is that this particular issue is more related with the wet, moist, soiled, and unhygienic type of buyers. No animal owner takes care about hygiene and sterilization in the cow sheds. So this particular problem is more important when we are going to discuss repeat breeding in the next week. That is infectious type of the repeat breeding. And then I will stress this particular point once again. Failure of balanced feeding. Feeding must be balanced. Animal is coming into the stress. That means energy level is proper. 100% energy indicates animal is coming into the stress. But it doesn't mean that all nutritive factors are fulfilled to the animal, and therefore deficiencies of the minerals, vitamins, and many other deficiencies, they are leading to repeat breeding type of problem. Unavailability of area specific minerals. Government has spent lakhs of rupees for establishment of soil, fodder, blood relationship, and deficiencies of the minerals. When we are working under the field condition, we should have a clear-cut knowledge about that particular area, the district, that which are the deficiencies, mineral deficiencies in the fodder, in the soil of this particular region. So if such a type of mineral mixtures are advised, and if those are made available, definitely this problem can be solved. And friends, it is important that every time, whatever the report which is available with the website of government of Maharashtra for mineral mapping attempted by NDDB and also by MAFSU, we should just refer it, and that will clear our ideas about the specific requirement of the minerals in a particular area. Next one is no control and monitoring on AI. For first 2-3 times, paravet will come, then the owner will call to the veterinarian. If the problem is persistent, he is not helpful to the veterinarian, professional veterinarian, again he will call para-veterinarian, he will change the person, and changing the person will not suffice the purpose for making the animal pregnant. Liaison with the veterinarian and attitude of inseminator, these are also important type of the thing while handling the cases of repeat breeding. Investigations. Friends, in any case, whenever the case is reported to us, we have to go for diagnosis, and owner should recognize that yes, doctor has analyzed this case, he has evaluated this case, he has diagnosed this case with laboratory type of aid, with his skills, with his clinical type of experience, and then only we should go for the treatment. Immediate treatment we should not go for in case of a repeat breeding problem. Ever-changing cause of the case, this is also important. This is also important. If this time, if it is not a proper thawing of the semen, next time it is not the deposition of the semen at proper site. Third time, it is not the proper time at which we have inseminated the animal. Every time animal will repeat and blame will go to that particular animal, that animal is not conceiving. So friends, remember, the cause may change with the repetition of the case. Follow-up is necessary. Once we accept any case of repeat breeding, we have to make that animal pregnant. Once that animal becomes pregnant, we are relieved, otherwise not. So whenever we are accepting the case, accept the case as a challenge, and it is possible to make the animal pregnant within first 2-3 maximum cycles. That's all. And I'm confident that everyone of you must have this type of experience. Next one is attitude to dispose infertile animal, that I have already told in case of buffaloes, and even in case of cows. Once the animal becomes weak, emaciated, lean and thin, that particular animal is thrown for gaushalas, and there is a flood of such a type of infertile animals in gaushalas. That is impatience and poor scientific knowledge of the owner. This is most important thing. And owners, they are not demanding for laboratory facilities. I personally feel very bad that if the milk rates are not increased, nothing will happen. There is no problem as far as the economics of the dairy owner is considered. But if lab facilities are not there, they are losing crores of rupees because their animals, they are remaining non-pregnant. So what is most important? Make your animal pregnant on yearly basis and just get maximum milk. That must be the approach. Next one. Next. All right. Now this is the causes of the repeat breeding. Today we have to deal with the non-infectious causes, but still causes are multiple causes. Minimum 10 slides are required to display total number of causes. Friends, formation of this particular system, reproductive system itself, should be normal one, and that we have to check at the time of pubertal stress. Last time we have discussed. So this normalcy of genitalia, starting from ovaries up to the cervix and even up to the hymen, this is important in case of repeat breeder animals. Hymen should not be intact. This is number one. Cervix should be straight one. It should not be kinked one. That is another important one. Endometrium should be normal and functional. Absence of endometrium is also possible in many cases. Blocking of the lumen of tubular genitalia is possible. Segmental aplasia of the parts is possible. Bands available in between the lumen, that is also possible. Ohero-bursal adhesions, possible. Blocking of fallopian tubes, possible. So anatomical disturbances are possible when we considered about this type of repeat breeding problem. So if everything is normal anatomically, structurally, then only the animal can become pregnant. Second important is the management. If the structure of the genitalia is normal, then in case of management, The first and the foremost line is synchronization of ovulation and insemination. We are bound for insemination and proper time of insemination. But as far as the ovulation is considered, owner's participation in this particular process is necessary, and therefore he should recognize and note date of estrus, date of past estrus, followed by total duration of past estrus. Animal was in estrus before 21 days, and that particular stage was continued for 36 hours, 18 hours, 48 hours, whatever it may be, 2 days, 3 days, in local language, let them tell, but let them tell how much is the total duration of the estrus. That is their duty, so that you can synchronize this particular insemination time for successful fertilization. In case of buffaloes, please remember that hit the animal immediately when animal is in estrus. Even if it is a Murrah buffalo, even if it is a Jaffrabadi buffalo, even if it is a Pandharpuri buffalo, short estrus is always observed, and buffalo starts estrus during night hours. So whenever the case is presented to the clinic, it is best time to inseminate. This is also true for Indian cows. But specifically, if a cow starts estrus in the morning hours, then we have to go for insemination in the evening hours. And all crossbreds and dairy cows needs to be inseminated only in the last 12 hours of estrus. Third phase of the estrus, last 12 hours of the estrus. This is dependent upon the total duration. 48 hours, 60 hours means last 12 hours. If it is 36 hours, it is the last phase, means last 12 hours of the estrus. So this particular part is important. More the herd size, more are the infertility problems. But this should not happen even if the herd size is more, because even the herd size is more, 80% animals must be pregnant and 80% animals must be lactating. Of these, 67% animals must be lactating and pregnant, and 17% animals must be only lactating, and 17% animals must be advanced pregnant. So those lactating 17% animals are only to be followed. And therefore, if we are following those type of animals which are parturited before 60 days or 90 days, that is in the case of cows and buffaloes, that much is the vigilance, that much is the observation. But perfect type of diagnosis, perfect type of follow-up is necessary under the management. Endocrine disturbances is also a major problem in case of non-infectious breeding problem. We expect that animals should have strong estrus. It's okay. If progesterone level of the last estrus is strong, then only animal will exhibit maximum estrus signs with maximum estrogen level. Brain will respond to the estrogen in a strong manner if the progesterone level of the last cycle is strong. So this expression of the estrus with the strong level of the estrogen is important, but many animals, they prefer intermediate type of the estrus. This indicates that progesterone level is that way less in these animals, and therefore please remember that strengthening of the level is important. It is not only the absolute level, it is the ratio of estrogen and progesterone. It is release of the progesterone. It is the response to the progesterone by the concerned organ. And also, please remember, this particular progesterone may not be responded well by the concerned target organ. This is also possible. Every time we have to make sure that yes, the level of the progesterone is good one for fertility, and therefore please remember that we have to also consider the endocrine profile. Immunological type of infertility problems, they lead to infertility. When we are inseminating, there is a clubbing of the semen, head-to-head clubbing, tail-to-tail clubbing. There are 16 different types of proteins which are available on the surface of the sperms, and these proteins, they act as antigens when we are inseminating a particular cow. So this particular antigen is responded by the antibodies from the cervical mucus, and therefore there is a clubbing response, precipitating response. The sperms are not allowed to move, so everything is possible, and it becomes very difficult to diagnose why this particular animal is not conceiving even after using of the semen. But if we change the straw, definitely we are getting the results. Same thing is also important for the straw quality. Causes, they also indicate poor quality semen. And friends, out of 100 frozen semen straws in stock, we are authorized to inspect and confirm the quality of the straw at least once in a month, and definitely that particular assessment will not lead to any type of official objections, because for that particular lot we are confirming in the laboratory that this motility of the straw semen is minimum 40%. So if this type of confirmation is initiated by all the professional veterinarians, definitely it will be a breakthrough. Environment is most important. Environmental stress. Animals should not suffer any type of stress. How to recognize animals are not under the stress? Very simple. Number one, 80% animals should have recumbent position in a day. Animals should take rest for 18 hours a day. And of these 18 hours, animals should go on ruminating for 14 to 16 hours. Continuous rumination and this type of recumbent, comfortable position, that is the stress-free type of environment for the animals. Number of animals must be observed in a sitting position. And these observations are to be taken 8 times, 10 times in a day, and average 80% animals should have a resting period. About the nutrition, we have already discussed that many factors are there, particularly iodine we have to take care of, and phosphorus. Iodine and phosphorus, if these two things are taken care of, maximum problems can be resolved as far as the repeat breeding is considered. And about the pathological conditions that we will discuss in the next week for inflammation and infection. But these all other factors are so important that n number of causes we can enlist, and therefore this non-infectious repeat breeding problem is related with 500 plus causes: sperm defects, ova defects, zygotic defects, chromosomal aberrations, immunological problems, environmental problems, nutritional problem. Every nutrient is a problem. If that is deficient, definitely it will cause repeat breeding. Considering these type of the things, the list is unending, and therefore you are requested to have these type of causes in your mind. Next one. The next. Right. When a case comes to the clinics, we have to go for assessment. And the first and the foremost thing is that we have to go for clinical assessment. Whatever is the history that we have to record about the cyclicity, duration we have to record. Number one, inter-stress interval, 19 days to 22 days is normal. Animals should have normal cyclicity, inter-stress interval. Stress duration, that will help us to diagnose the perfect time for insemination, and that we can ask to the owner. Body score condition of the animal should be checked. It will indicate that yes, animal is that way better in body condition. Animal is also having luster, skin luster, that is most important. And with this type of history in the mind, we can go for rectal examination. In non-infectious reproductive animals, on the day of the stress, as we have discussed earlier, the three things are pathognomonic. Number one, open cervix. Cervix remains open. Number two, tonicity of the uterine horns. Both the horns, those are slightly erectile type of feel they have. And ovaries of the two ovaries, one ovary will show pre-ovulatory mature grafting follicle, blister-like, sizable. Remember, it is a sizable, 1 centimeter and more. It is just like a blister on our palm, and fluctuating type of feel is there that will indicate estrus stage, irrespective of discharge. Please remember, discharge is not related with the confirmation. Discharge and other 30 signs are the signs. Basically, those are for farmer breeders. He has to identify the stress on the basis of the signs, but we have to confirm the stress on these 3 things. So once we are confirming this particular point, animal is fit for artificial insemination. This animal needs repeat examination on day first. If we are inseminating that animal at appropriate time, after 24 hours, if we are observing that animal, the site at which there was developed a Graafian follicle, that will show a pit, a depression, and that is the indicative of ovulation. If there is no ovulation, it is a case of delayed ovulation. That will indicate the delayed ovulation type of case, and accordingly we can treat for second insemination or maybe for some other therapy. If we are observing this particular animal on day 10th, and if we are getting the same follicle on the surface of the ovary, remember, it is a atratic type of follicle, it is a cystic type of follicle on that particular ovary. No ovulation has occurred in this particular animal. Day first there was follicle, day 0 there was follicle, day first there was follicle, and day 10 also there is a follicle. Means it is not a CL, it is a follicle. No ovulation has taken place. Unovulatory follicle will be there. If there is CL, it indicates that the case was having only delayed ovulation, and afterwards, after ovulation, this particular animal is showing carpus luteum. See the carpus luteum, it is very palpable type of the structure, and once our idea is clear, this is throughout the life, no one will forget. Throughout the life, no one will forget. It reduces the size when it becomes regressing carpus luteum, but it never loses its thickness, its consistency. For follicle, there is no reduction, it is bursting, and therefore that after bursting there is a pit. But for carpus luteum, there is a slow reduction in the size, and this particular gram size CL, it becomes a jawar sized CL. So this is the problem. We can also go for scanning of the animals. On day 0, follicles, those are observable. On day first ovulation, we can check through ultrasonography, and also day 8, we can confirm the CL in case of repeat better animals, that whether there is a CL or not. So if these 3 things, CL and GF, if it is palpable, our clinical type of approach and our clinical observations, they will complete. Next one, please. Next. Right. Now laboratory. Why there is a necessity of laboratory? A discharge which is a crystal clear one, and if animal is repeating, there is a chance that this particular discharge needs to be investigated in the laboratory, because we cannot adjust the infection through our naked eyes, and therefore we can send the discharge for color, consistency, odor, pH, burning pattern, Metricheck score, everything we can check in the laboratory. We can get the results, ready-made results we can get. Many veterinarians, they carry pH paper with them. It's a good habit. Immediately when there is a discharge, check the pH. If it is away from the normal toward the acidic side or toward the alkaline side, below 6.6, more than 7.4, it is indicative that pH is altered, and this too acidic or the too alkaline type of the nature of the discharge will not lead to conception in case of the animals. For blood, we can send the blood samples for phosphorus, particularly hemogram, and also for protein levels. Vitamin A, protein, and phosphorus. These are the 3 directly related things, and therefore we can go for it. Vaginal swab, it is to be sent for culture sensitivity examination. Cytobrush technique is available. It's only a brush, as I have shown in the picture. We can get the sample and we can send it. Endometrial contents we can evaluate with white cell test and PMN cell count. These are the lymphocytes, polymorphonuclear lymphocytes, and then we can check their number and semen evaluation. These are all laboratory type of the things, and they have more relevance, except few, for pathological condition and that to infectious type of repeat breeding. We are all going to discuss everything about this thing. Color in case of non-infectious discharge is crystal clear and watery, transparent, no color at all, no turbidity at all. Consistency is always thick for the discharge. Ropey string is to be observed, tensile strength is to be observed, and spin barquette property. It extends just like chewing gum, so that spin barquette property is to be observed. Purning needs to be confirmed. Good veterinarian will confirm purning, and purning is 100% indicative of estrous cyclicity or estrous stage. Is very, very important. Next one. Next, please. Yes. So this purning pattern, please remember that the first picture is clear-cut indicative of purning. Observe under microscope. Nothing is required. Only a glass slide, grease-free glass slide. Just touch it to the vaginal mucus or the mucus string and put it under microscope. That's all. No need of drying, nothing. Immediately under 10x microscope, you will find purning, perfect purning type of pattern. If this pattern is perfect, animal is in estrus. In case of animals where purning is confirmed, and if the cycle length is a regular one, if it is 21 days perfect, then still if animal is repeating, then there are chances of failure of fertilization. So this case may be of failure of fertilization. Number two, it is the case of weak type of corpus luteal development. CL may not be developing in a better manner. And the third thing is that this particular animal may have conception followed by failure to go for implantation. So such a type of cyclicity, clear estual discharge, purning pattern is indicative, and regularity of the cycle indicates that this is a case of fertilization followed by this. In case of repeat breeder animals, please remember that 25 to 30% animals, they fail for fertilization. 25 to 35% in case of repeat breeding. Other they conceive, 75% they conceive, but they are unable to carry up to the term or carry it into the embryonic stage. If the same type of the case having irregular type of estrus, then animal is repeating after a gap of one cycle, maybe after 30 days, 35 days, 40 days, 45 days, then it is indicative that yes, there are chances of fertilization, 100% chances of fertilizations are there. But this particular case is related with embryonic death or embryonic mortality. After implantation, there is a problem. And in case of repeat breeder animals also, please remember that if animal is showing any type of discharge from day 4th up to day 8th, any type of discharge after insemination is indicative of acute endometritis. 4th day to 8th day, acute endometritis, and from 12th day to 16th day after mid-cycle, 12th day to 16th day, it is a case of chronic endometritis. So these two stages are also important that you should remember. And the day on which there is a discharge, that is indicative of many things in case of the animal. So I have enlisted this type of chronology, that animal is in estrus day 0, animal is in estrus on day 1, animal is in estrus on day 2, day 3, day 4, day 5, continuous up to 120th day. What are the possibilities and how it is we can deal this type of cases. Next. The next one, right? Assessment and the criteria. See, if our criteria is perfect, we can classify this particular case into two categories: infectious or non-infectious. Say, for example, today we have to discuss non-infectious, but it is important to note that estrus mucus is a transparent, crystal clear, without any color in case of non-infectious repeat breeding condition. pH is perfectly 6.6 to 7.4. It is approaching to 7. It is always 6.8, 7.2, and there is no problem of pH. Metricheck score will not show any type of turbidity. 0 score. 0 score is indicative that this discharge is a normal one and it is not contaminated. The next one is the white cell test. Very simple type of test under field condition. Sodium hydroxide solution. 1% sodium hydroxide solution, and this particular discharge, this is to be heated for 1 minute, and we have to observe the change in the color. No change in the color is no infection, no infiltration of leukocyte, and that is indicative that animal is negative for any type of infection. But this is indicative. As I told, vaginal swab, if we go for staining and if we go for polymorphonuclear cell leukocyte count must be less than 3. 1 to 3 cells are always there. Up to 4 also there are cells. Cells number should not be more than 5. That is more important. And about there is no need to go for this culture and sensitivity test or antibiotic sensitivity test when the discharge is crystal clear. In some cases, crystal clear discharge do carry infection, but unless and until we feel that there is a necessity to go for culture and sensitivity, we should not go for it. Perm pattern and all those things, they will cover the animal within 1 or 2 cycles. Chances are there that even a crystal clear discharge can also have infection. So please remember that this is not a thumb rule that always transparent discharge is clear from infection. It is not like that. Next one. Next. Right. Ovulation delayed. The case is possible with that normal time of ovulation, that is 6 hours to 12 hours after a cessation of the estrus, there must be ovulation. If animal fails to ovulate, then on second day examination, it is possible to check the Graafian follicle. Owner will also report that, doctor, you have inseminated my case, but this animal is showing the signs of the estrus even after 12 hours, 16 hours. These are the cases of delayed ovulation. And in those cases of delayed ovulation, we have to go for repeat insemination after 24 hours of first one. After 24 hours of one. If a case or if a cow is off the heat after 16 hours, that cow is also to be inseminated, that is re-inseminated after 24 hours only. It is not at the 16th hour of first insemination. No, second insemination is always after 24 hours of first. This is the thumb rule, and we have to go for it. Ovulation failure is a big case. Second day, third day, fourth day, go on palpating the ovary, and you will find that that particular follicle is there on the surface of the ovary. As long as follicle is unovulated, animal will continue the signs of the estrus for 2 days, 3 days, 4 days, whatever it may be. And there are cases. A person was informing me that his buffalo is continuously in estrus since last 8 days. Maybe a case of cystic ovaries. But friends, remember, we have to differentiate this non-infectious repeat breeding category, ovulatory failure, and the ovarian palpation. We have to record for ourselves to come to perfect conclusion. Cyclicity and the ovulation, they have aberration pattern, they have different type of abnormalities. Short or the prolonged cycles, we have discussed that if the cycle is less than 21 days, say for 16 days, 17 days, 15 days, it's a short cycle. This needs to be avoided for insemination. We are not inseminating for short cycles. But if it is a prolonged type of the cycle, 23 days, 25 days, 27 days, then we will have to first assess that what is the problem, and then we have to go for insemination in case of prolonged type of the cyclicity or the prolonged inter-estrus interval. If the stage of the estrus is short one, there is no problem. It happens in case of summer. It happens in case of starting of the breeding season. It happens in case of nondescript animals, and therefore short of the duration of the estrus is normal one. We have to hit that particular animal, and once we are detecting it. But in case of prolonged estrus, we have discussed that it should be repeat type of insemination after 24 hours of the first. Split estrus. Animal is in estrus on day first. Animal will show the strong signs of the estrus on day second also. We will be inseminating that animal on day second. Animal will go off the estrus. Owner is satisfied that yes, insemination is successful, ovulation must have been occurred, but the same animal comes into the estrus on day fourth, because day third is the rest day. Animal will gain the energy, animal will gain the glucose level, and once again animal will start signs of the estrus, indicating that there is no ovulation till this time. Split estrus is because of exhaustion phase. This phase is for 18 hours, 24 hours, 36 hours, depends upon the level of the nutrition. If nutrition is strong one, animal will immediately come to the stage of the exhibition of the estrus. But it is confirmed that there is a prolonged type of the ovulation. It is unnecessarily getting delayed, and we have to treat this particular case as a prolonged type of the estrus. Infective estrus turbid discharge is very crystal clear. Many cases, farmer breeders, they generally never claim that the discharge is turbid one, discharge is whitish one. Even if they observe, they are not informing this type of thing. Their observations are poor, and this is illiteracy also. But we are not going to miss this type of whitish or any type of turbid discharge in case of infected animals. Super ovulatory response that we have to check in case of the animal. If there are 2 or 3 follicles ready for the ovulation, then we have to check it. And it is better not to inseminate that particular cow, because twin pregnancy is not expected in case of monococcus species in cows and buffaloes. Cows and buffaloes should have only one calf for better performance, better reproductive performance in their life. So this double or the twinning is not expected. False estrus is the estrus where only estrogenic signs are there. It is just like a estrus where without follicular development, when the estrogen level increases in the body, animal will show all the signs of the estrus, but follicle is missing on the surface of the ovary. That is a false type of the estrus. We are not concerned with the insemination for such a type of the estrus. And the gestational estrus, definitely it is the follicular development but no ovulation. Follicular development but no ovulation. So if animal is pregnant one, then no need to go for any type of insemination. So this is very important one. Next one, I have tried to show crystal clear type of the discharge, but you can also have observations about the transparency. Next one, right? So what are the solutions in case of non-infectious reproduction? Number one, AI management. We should have best synchrony for ovulation and insemination, and that management is in our hands. When to inseminate, where to inseminate, how to inseminate, and how better we are going to improve our conception rate. That is the first and the foremost thing in case of non-infectious reproductive animals. Number one. Number two, whatever the skills which we are adopting, we have to improve it slowly. If this year my conception rate is, say, for example, 50% is the success rate, next year I have to improve it to 60%, 70%. Likewise, accordingly, I myself will have to improve for artificial insemination skills. Pattern confirmation is the best remedy in case of non-infectious reproductive animals, because that gives 70% conception rate, and that is a very useful type of technique. And ovulation follow-up. Every case need not to be correctly followed after insemination, but advise owner that check after how many hours this animal will go off the stress. Owner can report this many things. Owner can write these many things. Owner can note this type of thing, that after insemination, animal should be off the stress within 12 hours. That is the criteria, and that owner should cooperate for this. The treatment. We will have to treat these type of cases. Number one, for prompt ovulation. Number one, better development of the CL and form the strong level of progesterone. So these are the important type of the things. And if endocrinology, if we are making the animal strong, and if we are making these endocrine events proper by exogenous applications of some or other approaches, then we have to also ensure continuation of implantation by this conceptus and continuation of pregnancy with embryonic stage. So these are all the things related with the treatment aspect. Next one. Next. Right. Crystal clear type of the discharge. And always, even if animal is not repeat breeder, preventive dose of Gynaeric or the Receptal 2.5 ml intramuscular without relationship of artificial insemination. Never think that yes, it's possible that before insemination I will inject, after insemination 15 minutes, 13 minutes, 1 hour. No relationship as far as this injection and insemination is considered. Animals should not get disturbed with your injection. It should not lead to stress. It should not lead to blocking of the sperm transport. That is all expected. That's all. Inject smoothly, inseminate gently, skillfully, and you will suffice the purpose. Maybe at a time, maybe with a gap of 30 minutes, and it is your purview to decide the injection GnRH. Preventive dose is also possible. Even if the case is not that of the repeat breeding, we can use 2.5 ml for better synchrony of ovulation and insemination. Why? Why this GnRH? This is for three things. Number one, GnRH is a chemical analog. It will stimulate endogenous increase in the level of the LH. Endogenous increase. Whatever LH is available in the body, that will be raised under the effect of GnRH injection. And LH is required for three things. Number one, prompt ovulation. Prompt ovulation is second. The first one is signs of the stress. LH will support signs of the stress. LH will support ovulation, and LH will support luteinization of ruptured Graafian follicle. That means luteotropic effect. Three effects. LH has three utilities. Number one, support for estrous signs in the second phase of the cycle. Ovulation, prompt ovulation, if LH surge occurs, highest level of the LH occurs. And the third one, luteotropic effect, luteinization of entire ruptured Graafian follicle, that is possible. Now, this particular GnRH we can inject on day 3rd and day 5th, because that is the stage of developing corpus luteum, and during developing corpus luteum, if we once again support LH, it is luteotropic, and luteotropic will well built. Structurally, it will form a strong type of corpus luteum with the GnRH. Safe. GnRH is more safe because it is not a hormone, it is a chemical analog. The third one is GnRH on day 5th and also on day 12th. 5th day and 12th day. Now, 5th day, it will be luteotropic. And on 12th day, it will further support corpus luteum for making higher levels of progesterone. Levels will be increased. More progesterone is required on 12th day, 13th day, when embryonic signs are coming from the conceptus. and that day support required is more. Gestational support required on 12th and 13th day is more, and therefore this 5th day and 12th day, that is possible. Many people, they choose Hormonal, no problem, no issues. If it is a reasonable one, and if it is not going to be repeated regularly, then direct source LH we can use. It is 80% like LH, and it will go for the same things, luteotropic effect, if we are using it at the time of insemination. If we are using it on day 5th, it will be once again luteotropic, and this will give the results. Progesterone, again, once again coming to the CL, and that to a strong CL. If endogenous CL or CL which is available on the ovary is not secreting expected amount of the progesterone, then we can go for progesterone on 7th day, 10th day, 13th day. Likewise, we can schedule, and quantity required. Please remember, market availability is 1 ml is equal to 250 milligrams. That is more than sufficient. 100 milligram, 100 milligram, 100 milligram. That is sufficient for 3 doses. 250, 250, 250 will lead to increased duration of the cycle. That is not at all required. So 1 ml, 250 milligram into 3 divided doses, or you can have 100 milligram, 100 milligram, 100 gram, 3 times that can be injected. One more important aspect we can go for is the non-steroidal anti-inflammatory drugs. And these drugs are useful. They have definite type of mechanism in preventing prostaglandin production from endometrium, that we will discuss. So this is the line of the treatment, and this particular line of the treatment we can adopt in case of non-infectious repeat breeder animals. Next one. Next. That's right. Ovulation protocol. This is a strong protocol, and this protocol is not only meant for anesthetized animals. This is also useful for repeat breeder animals. If we start this program on day 7th or day 8th, that is during distress, it gives best results. We have tried this particular program from day 0 up to day 7th or 8th. Day 0, day 3rd, day 7th, and day 10th. It gives best result during distress. So if we start it by 8th day or 10th day, we will be getting maximum conception rate in case of non-infectious repeat breeder animal, because everything is managed here. If we go for GnRH on 8th day, the second wave of follicular development that is available, and that will form the follicle. On 7th day, that is nearly by 15th or the 16th day, CL regression, natural corpus luteum, that will be degraded. Whatever extra CL is formed, that is also degraded by luteotropic effect, and the follicle will develop, animal will come into the stress, and we are heating again with that of the GnRH and AI. This is the technique in case of non-infectious breeder animal. Go for it, check many number of cases, and you will get the results. Next one. Next. Right. If the animal is having tubal blockage, if the fallopian tubes are blocked, if the oviducts are blocked, salpings are blocked, then it is very difficult. It's not so difficult. Phenol sulfaphthalin, PSP test, or starch grain test is there. This is a dye solution. Make a dye solution, inject it inside the uterus. Simple. Whatever the solution, pinkish solution you are going to prepare in the laboratory, it is a sterile type of solution. Put it inside the uterus, and after 30 minutes, maybe after 1 hour, collect the urine of that particular animal. If the pink color appears in the urine, it indicates that that particular stain is carried from uterus to fallopian tubes, and fallopian to internal os to peritoneum, and absorption through a peritoneum, it has appeared in the urine, and therefore there is a pinkish coloration to the urine. Means fluids are able to pass from the fallopian tube. This is a simple type of technique. Very simple, very useful, because unless and until salpings are inflamed, unless and until there is salpingitis, we are unable to palpate salpings, and therefore this test we can perform, and also we can go for this test under field condition. Semen quality we have already discussed. The next one. Next. Right. And sky is the limit for nutrition. You can have your own experience as per the area. Specific mineral mixtures are considered. Energy supplementation you can provide to the animal. You can provide energy from insemination for 10 days, so that fertilization and other the post fertilization events, those will be normal. Immunoinfertility, if the straw is from one bull, you can change the straw, and also you can have experimentation for avoiding immunological factors. But never use progesterone on day 0. ठंडा करने का injection throughout the northern India, this particular term is used. ठंडा करने का injection दे दो. No insemination with that of the progesterone. No, never use progesterone -3 and +3 days, 0 day. So this is the schedule. After 7th day, you can use it as per the requirement. Don't use oxytocin, pitocin on the day of the stress. It will lead to hypoluteinization. It affects the luteal development. So oxytocin and pitocin is also not expected. When there is unexplained infertility, when nothing is observable, nothing is detectable, 1 cycle rest is the best remedy. 25% animals, they conceive if we just leave these animals without breeding. Non-infectious breeding case, give them rest for 1 cycle. The next cycle, animal will come into distress and animal will conceive with 1 single insemination. Please remember, this is also possible in case of unexplained infertility. All things, subfertility, unexplained infertility, we cannot diagnose. And therefore, we can have this type of thing. Hormonal protocols I have already given, Ovulation and this protocol from 5th day, 7th day, 8th day, you try it, and as per your own observation, you can repeat this particular program in case of more and more number of cases. Yes, next one. Right. This is another important problem, and it is not a problem, but it is association. I have shown only crossbred cow, HF and crossbreds, Jersey, or a Gir with a very strong body score condition, Sahiwal with very strong body score, very strong, underline this word, very strong, they will show such a type of bleeding. This bleeding occurs on day 3rd or day 4th of the cycle. This is all physiological and normal. No treatment is required for this. And please remember that this particular case is not to be treated. Cleaning of external genitalia is the only important thing. The day on which blood comes out, conceptus is available in the fallopian tubes. Conceptus will come into the uterus on day 5th or day 6th. Metastas bleeding is on day 3rd and 4th. 3rd and 4th near external genitalia. Day 3rd and 4th, conceptus is safe inside the fallopian tube. So nothing to bother for metastas bleeding. On the contrary, metastas bleeding is a certification that owner has maintained his animal with very good body score condition, with very good nutritive type of management. So please remember that metastas bleeding has nothing to do with infertility problem. Next one. Next one. Right. If cyclicity is irregular, if animal is repeating by 27th day, 30th day, 35th day, in those cases, we can assess that fertilization is taking place, but then there is a problem of continuation of this particular animal to carry the pregnancy, and chances of early embryonic mortalities are more. 3 stages. which we have to consider. Number one, that early type of early embryonic mortality, late early embryonic mortality, and failure of cow to recognize that cow is pregnant. So remember that any cycle which is extended more than 21 days up to 26, 27, 35, whatever, if such a type of extension is there, definitely this is the case of early embryonic mortality. When we are adopting AI, when we are attempting AI, generally we are advising some good preparation, jaggery to this animal for energy. So continue the energy supplementation for 5 to 10 days to have the chances of conception and implantation. A small quantity, maybe 100 grams of wood will suffice the purpose. We can also advise for minerals, extra minerals for 10 days. We can also advise for shatavari. We can also advise for leptadine tablets. Please remember, 10 tablets 10 days after insemination for improving in the conception rate. And we have observed the results. Excellent results we are getting if we have some supplementation after artificial insemination. If this particular supplementation is over, then if we our seed germination test, which is practicable on 11th or the 12th day, 15th day for the farmer breeders, if that is positive, more germination is inhibited in this seed germination test. Sprouting out, germination is stopped because of the pregnancy contents in the urine. That is the seed germination. Very simple and very effective, 60 to 70% effective test. CL presence on 18th day. Remember, 18th day, 19th day CL. Milk progesterone test, if it is available on the field, that is positive on day 18th, day 19th. Failure of animal to repeat on 21st day, or pregnancy diagnosis by blood examination on 28th day, milk blood progesterone test, that is all, those are available now in the market, and ultrasonography if we are attempting on day 30th, day 35th, and if this particular indicative type of pregnancy, if these type of signs are all positive for the pregnancy, when we go for confirmation, there is no embryo. This is the case of early embryonic death, early embryonic mortality. If animal comes into the stress on 37th day, 35th day, so all these things were positive, and only on 37th day animal has repeated. It means that there is a death of the embryo before 10 days, before 9 days, 8 days, like that. So this type of case is possible, and therefore there is a regular type of these stress. Next one. Next, right. Early embryonic mortality is possible from 07 to 18th day. Conception will not continue because there are many things, and endometrium is the major culprit part where there is no acceptability of conceptus to the endometrium. From 15th day to 17th day, if there is a death of the embryo, cyclicity is generally normal. It is generally normal. And this 15th day to 17th day is a crucial period, because that immediately it is followed by 18th and 19th day, where lethal genes, they are affecting the embryo. And therefore, period of lethality is the day 18th, 19th. Poor recognition of embryo by the endometrium. This is a part, this part is more important, and this starts from day 12th up to day 18th. Embryo will come in contact with that of the endometrium, and there is a dialogue. There is a dialogue, communication, chemical communication between conceptus and that of the endometrium. If this communication is perfect, if these two things they recognize each other, if there is immunosuppression, if there is establishment of relationship between the conceptus and that of the endometrium, the chances of loosening of the pregnancy are less. But if there is no recognition by the endometrium, weak development, poor endocrine glands, poor endocrine fluid, milk, everything, or altered pH of the endometrial fluid, everything is possible. Even temperature, endometrial temperature, if it is higher, this dialogue is broken, and that leads to early embryonic mortality. Progesterone non-availability is also an important factor from 12th day to 18th day. Conceptus will indicate that yes, I'm there. It will secrete some signals. These signals are going to endometrium, and endometrium is prevented from formation of PGF2 alpha. So embryo will communicate that please don't secrete PGF2 alpha. I have to continue the pregnancy. But if this communication is not proper, definitely there is a loss of the embryo. Late embryonic mortality is from 18th day onwards up to 45th day, and this is possible to be detected when we have sonography with us, when we are carrying out milk progesterone test. These tests were positive on 18th day, 21st day, 25th day. Everything was normal, and pregnancy was there. Location of pregnancy was also there. In that case, embryonic mortality is possible. So many causes are also there, and particularly chromosomal aberrations, lethality, environment, management, nutrition, these type of factors they affect for irregular type of cyclicity and repeat breeding. Next one, next. We are now at the fag end. Next one, please. Break ke baad. So friends, there was a break, and once again, last 5 minutes. That's so we will continue with the treatment of this early embryo mortality, and definitely that will be useful for we all. This embryo needs to be continued for development, and it is possible to maintain the pregnancy even if there are some factors which are obstructing the continuation of this development. The period itself is crucial. The first and the foremost thing we should discuss. So the progesterone is number one, which we can inject at a constant interval for, say, for example, a weekly interval we can go for, and 1 ml is sufficient. That is most important one. Also, we can go for this GnRH type of the therapy, and GnRH therapy is presumably it is on day 5th for making the corpus luteum strong, or on day 10th when secondary follicle develops. It can be directly converted into accessory corpora lutea, and therefore it is possible to go for GnRH on day 10th. It is possible to go for non-steroidal anti-inflammatory drugs, which we are regularly using on day 12th, because these drugs, they work, or they have indirect type of the action through COX-1 and COX-2. They prevent the endometrium to secrete prostaglandins, and therefore 12th day NSAID, that will suffice the point. Akshayji, please share the PPT, last 1 or 2 slides only, but.
Okay, sir. This one is the last, sir.
Is it possible, Akshayji?
Yes, sir. I'm sharing the last slide only.
And friends, be ready for some questions. There is opportunity, and if there's continuation of this internet, definitely we'll discuss about your queries. And we will have the next session on next Monday, as per the permission from our association for subclinical endometritis and repeat breeding due to infectious type of causes.